Is treatment just symptomatic?
Yes. So GBS, there are two options available for the GBS antibodies. Now I know that, having said that, the GBS is the autoimmune disease. Now autoimmune disease, nothing but the antibodies are they are flowing in my blood. Now I need to give some medication to neutralize this antibody effect. There is medicine what we call as the IVIG, intravenous immunoglobulin. Now weight based dosage of this IVIG is the only treatment, only medical treatment.
Are you flushing?
Yes, it will be given over a period of 3 to 5 days with monitoring of the kidney functions. It is quite a very allergic medication, but still the doctors will monitor it. It will be given under supervision. We have to monitor the kidney test. We have to give it very slowly, and it has to be given according to the body weight. Now that is what we call as a IVIG. Now second thing is something similar to dialysis, what we call as a plasma exchange or as plasmapheresis, where we will be filtering out the antibodies from the body of the patient.